Just like we have the words left, right, north, and south to give people directions in the real world, we have special vocabulary in anatomy so we can give people directions when we're talking about the body. When we're communicating with someone, we always want to make sure that we understand or that the other person understands what we're saying and that we're talking about the same thing. That's where anatomical directions comes in. So the first thing we actually want to talk about is something called anatomical position. This is the standard position we assume people in when we're talking about anatomy. And we can see this right here. It's standing kind of straight, looking ahead, and our hands, our palms are facing forward, and our thumb is outside our body. You can see then from this position, we have a couple different directions we can talk about. We have superior or above, inferior, below. We have medial towards the center of our body and lateral towards the outside. Then when we're talking about our limbs, we actually have some special words. We have proximal towards our trunk and distal away from our trunk. We can look at here and there's a couple more words we have now. So now we can have dorsal towards our back or ventral towards our front. Here we can also see some of the different planes in our body. We have the sagittal plane right in the center. We have the coronal plane right here, and then we have the transverse plane. And you can have that anywhere, making a cross section. We can also add the terms we just talked about. So we have superior on top, inferior at the bottom, and we can also add anterior in front of us and posterior behind us. So here we've just talked about a human, and humans are generally standing upright on 2 feet. But we also, when we're talking about animals, we want to use similar terms to talk about them. But now this monkey, he's on all fours, so he's oriented a little bit differently. So here, anterior still means in front of this monkey and posterior is behind. And now that is different than superior and inferior because superior means above and inferior means below. And here we have cranial towards the head and caudal towards the tail, and that's actually the same as anterior versus posterior, unlike in this previous one, where now superior and inferior are the same as cranial and caudal. So this is one of the instances where you want to be very careful about which terms you're using and making sure you're remembering what they mean. You can see dorsal and ventral, that means towards the back or towards the belly, and thinking about some of the definitions will help you remember which term is most appropriate. So, what are the different anatomical directions and why are they important?